Our next speaker of the day is Dr. Ginny Maril. Dr. Maril is a licensed psychologist who serves the states of California and Texas. She completed her Bachelor of Arts and Master of Psychology at the University of Dallas and then earned her doctorate at Texas Women's University and became licensed in California in 2012. Her program and internship were accredited by the American Psychological Association. Additionally, she is confirmed by the National Register as a health service psychologist. She's trained in a variety of treatment approaches and specializes in working with college students and young adults, as well as survivors of sexual trauma and those living with chronic illness and their caregivers. Please give a warm welcome to Dr. Ginny Maril.
Good morning, everybody. Thank y'all first for having me. It's really lovely to be here with y'all virtually. I hope things are well on the West Coast these days. I am going to see if I can share my screen. This is always the fun part of the program, right? Where we see if technology works. So let's see. Does that look like something that isn't me? Great. And is it the full screen that you're able to see of the PowerPoint? Great. Thank you for the thumbs up, Christina. I appreciate it. So today I'm going to talk about something that is no easy feat, and that is staying well mentally while living with scleroderma. So a lot of this is going to be focused on people who live with scleroderma, but also caregivers, and can apply to any of us humans on planet Earth. I hope that you find something valuable from this presentation, and we will get started. So as Christina mentioned, a little bit about me. I'm a licensed clinical psychologist. I currently work in the clinical piece means that I'm not in the realm of research, but I'm in the realm of practice. So I have a private practice. I also work at the University of Texas at Austin as their clinical director in their college counseling center. I am also the daughter of a scleroderma patient and of a scleroderma caregiver. So my mom was diagnosed with scleroderma back in 1994. She is still living with scleroderma. She's, it's ups and downs, as everyone in this room definitely knows, but overall doing well. And my dad has been her primary caregiver for the entirety of the time that she's been living with scleroderma. Like to share my preferred coping strategies, because this will come back into play as we are discussing things today. I love live music. I love to travel, like time with small groups of close friends. I love very long dinners, wine, the ocean, and being able to complete controlled tasks. So these are all going to be things that come back into play as I ask y'all to reflect on what y'all think of as your preferred coping strategies and what we do when we don't have access to all of them or most of them. Who I am not is a wizard. I can offer a lot of really good ideas. Some are going to fit for you, some aren't. If there were a magic solution on how to do this, I assure you this presentation would be about 2 minutes long. I would tell you what to do and how to do it, and then take my leave. Living with scleroderma is a difficult, just a difficult way to face each day. And so I want to acknowledge that at no point am I saying today, just do this, just try this, and this is going to be the solution to all your problems. Just want to offer a couple of different things to think about that maybe you can implement. Try them out. If they work for you, that's fantastic. If they don't, that's quite all right too. You can move on to see what a better fit might be. Again, don't have to tell anybody in this room that scleroderma will impact each area of your life. And the way that we break that down tends to be in this way: physical, functional, emotional, relational, and spiritual. So really no area is exempt from that, which means that in our approach to coping, we have to be thinking about all these areas as well. And it's my intent in this presentation to start with some of these impacts, what they tend to look like in people living with scleroderma. My hope with that is that it can normalize your experience, help you feel less alone in what you're living with. And then the second part of the presentation is going to be more focused on coping and how to deal with some of these challenges and be creative in the ways that we think about coping. So functional impacts show up everywhere. You know this. Your activities of daily living impact yourself. They impact your family. If we're not feeling well, we're typically not our best selves. And some days it's just easier than others to do these things. So as these functional impacts begin to take a toll on our life, we have to think about what are some alternatives that I can move towards in these areas, such as recreation or education. What are my future possibilities? Have they changed with this diagnosis? There are a lot of different emotional impacts that can happen. So some of the really common ones that people share with me include survivor's guilt. So, everybody in this room who has been diagnosed with scleroderma likely has different symptoms, different presentations. It might have changed from a year ago, might have changed from yesterday. And I would expect most folks in this room have lost somebody as a result. So it's not uncommon to feel some survivor's guilt or some guilt around, well, my course of the illness isn't as severe as somebody else's. What does that mean for me? Certainly loss is a part of scleroderma, whether that's literally losing someone to it or the loss of your ability to do the things that you once did, the things that you used to take for granted. Hostility is not uncommon. Again, we're not our best selves when we're not feeling well, and sometimes that comes out in crankiness, disappointment, very common, fear and uncertainty, because more is definitely known. Even in the last 10 years about this illness than before, but there's still a lot of fear and uncertainty. People's self-esteem and body image can be impacted. And there's the very real piece of having a visible versus an invisible disability. Each of those things come with their own complications. Typically for people who have some visible sign of scleroderma, deal with something different than people that don't have the outward signs, deal with a lot of doubt, people second guessing them, wondering if they're faking, and that can lead to anxiety and depression, which causes its own challenges. And of course, the challenges around repeated bereavement. If you've been in an organization or group like this for long enough, you've likely lost multiple folks, and that takes a real toll as well. Relationally, these are the things that we see show up in relationships. That might be in a romantic relationship, your partner, that might be family members, it could be friends. All these things we've been talking about show up also within relationships: sensitivity, hostility, irritability, that doubt dynamic, financial stress, of course, challenges of intimacy, trying to continue to grow towards each other and together when it might feel like isolating and pulling away feels better sometimes. And of course, the taxes on mental health. We know that people who have scleroderma are about 4.5 times more likely to receive a psychiatric diagnosis than the general population. And those typically look like the ones listed here. And it can be major depressive disorder, generalized anxiety disorder, probably the two most common ones. Adjustment disorder, that is typically a shorter course of symptoms than major depressive disorder or generalized anxiety disorder. And persistent depressive disorder is a much longer course. So that's the criteria for that involve a couple years of low-grade depression. So again, much more common to receive these diagnoses in addition to scleroderma, which further complicates the experience. So what does then that mean if I've just told you all these wonderful things that you likely already know. And what does that mean for me and my mental health? These are the things that we see in patients and in caregivers. Of course, increased stress. There's a huge laundry list of things that you get to be stressed out about. People experience burnout, compassion fatigue, and physical dysregulation. When our bodies are in a constant state of stress, it becomes much harder to re-regulate. It's like our body gets used to certain levels of cortisol and that stress that it induces. And then it's just more difficult for us to come back down and feel that sense of balance. And that shows up in a lot of different ways for people. These are some signs of burnout. Impacts to the immune system, changes in sleep or appetite. That might be, it could go either way. Sleeping too much, eating too much, or not enough. Procrastinating, overreacting to unexpected problems, just the smallest thing, maybe setting you off. Becoming isolated, picking fights with others, gastrointestinal problems, indecisiveness, problems concentrating, seeing only the negative, having racing thoughts, constant worrying, agitation, loneliness, headaches. So in all those different areas we mentioned before, the functional, relational, the spiritual, all these can show up in each of those areas as well. A lot of these symptoms probably sound familiar to scleroderma too. So how do you know what's coming from where? And how can we work on some of these things to lessen symptoms so that hopefully that contributes to lessening symptoms related to scleroderma as well, at least the ones that are a little bit more in our control, because some of these things are in your control, some of them are absolutely out of control. And today we're focusing on the ones that are within your control. So, take all of those things that we've just discussed, and then let's put them in the context of a pandemic. And this is what we're seeing. We know that disasters, recessions, pandemics are historically associated with higher rates of distress and psychiatric disorders. Seeing the same thing with COVID, seeing higher rates of depressive and anxiety disorders, higher rates of relapse among those with alcohol use disorder, higher rates of trauma, suicidal ideation, higher rates of substance use, higher rates of eating disorders. So the context of the world right now is also exacerbating symptoms, whether they're symptoms of psychiatric diagnosis, whether they're symptoms of diagnosis of scleroderma. We also know that people who hold marginalized identities are living in different contexts and more stressful contexts as well. So there's a lot of different pieces that can contribute to experiencing stress. So scleroderma is a big piece of this puzzle, but I don't want to forget all the context that you're living in while living with that diagnosis too. So what we know is that we don't burn out because we're doing too much. We burn out because we're not taking care of ourselves. We're actually really good at being able to do a lot of things, but we have to be commensurately taking care of ourselves to the same degree that we're doing things. So the output and the input have to be at least equal. Ideally, we're getting more input than output. We have to think about our checks and debits, basically. We can only write so many checks until we're going into the red. And the same with our bodies. So that is going to be the highlights of the challenging parts of living with scleroderma. I tend to call it the really pleasant part of the program, where I give you all these horrible things that a lot of you already know, you're already living with. And I want to now shift a little bit about what are we going to do about those? What are some of the things that we can't do? And I expect that a lot of y'all have heard a lot about self-care, as my hope. It's definitely more out there in the vernacular. I think people are talking a lot about it, much more than they used to. Because it's a paradigm shift. I think we are set up in a society that asks a lot of us, as far as productivity. It frames self-care as selfishness versus survival. And I really want to continue to help shift that narrative to thinking about this as something that's critical to all of us in living better and surviving. Self-care shows up in a lot of different ways, which is lucky for us because sometimes we lose access to certain parts of these. So these self-care are just actions that restore balance in our personal and professional lives. That can be intellectual, physical, spiritual, occupational, environmental, emotional, social, and financial. And so one of the challenges today is to start thinking about what ways can I care for myself in these different domains. Intellectually, it might mean learning something new. Physically, this is going to look really different depending on how your illness shows up. What are some things that you can do to care for your body? Spiritually, what is that thing that connects me to something larger than myself? For some people, that is religion. For some people, that's spirituality. For some people, that's nature. Just anything that connects you to something bigger. Scleroderma does a really lovely job of trying to isolate. But I think what's really beautiful about the Scleroderma Foundation, about your individual chapters, are that it does provide this space for connection. Trying to think about self-care at work. If you're working, that is very challenging. Again, typically work is not set up to give us a lot of space for this. People in the United States are exponentially less likely to take the vacation that they have. They're less likely to take the breaks during the day that they're given, less likely to take lunches, all these things that are so critical to taking care of our bodies throughout the day. And that can be a real challenge of setting and holding boundaries, which is difficult to do, especially if you've been socialized not to do that. Environmentally, thinking about self-care, what does your environment look like? Typically, our external environment is a reflection of what's going on internally, like our internal state. Is it cluttered, messy, hectic, disorganized, or is it clean, organized? And does that help me feel better? And can I work towards that? Emotional self-care, we're going to talk about a lot of different ways to do that today. Social, these connections you're making here, having people in your life who feel recharging to you, not people who you leave and feel drained by. Really thinking about who's in your life and what that looks like. And then financial self-care. This is a really difficult one. It is not cheap to be ill. I know everybody here knows that. So trying to figure out ways to take care of yourself financially as well can be very challenging. So I mentioned these earlier. These are my preferred coping strategies. And when the pandemic hit, all of these were, except a couple, were taken away, right? And right before the pandemic, I relocated from Los Angeles to Austin, Texas. So that coping strategy of the ocean got a little bit more difficult for me to access. The ones that remained were controlled tasks and wine. So those probably aren't the two most healthy tasks or coping strategies for me to have access to. So I had to work really hard to figure out, okay, then what else can I do? What are the ways that I can engage with these other things? How do I make sure that I'm practicing self-care creatively? Because if I just rely on wine, that's not going to be good for my body, my mind, anything. If I focus on controlled tasks, then that might like increase anxiety. It's not going to be a really strong coping strategy for me. So just a way to think about what that might look like, because some days you'll have access to your preferred coping strategies and some days you just won't. And the more that we have, the more that we know about ourselves, the better it's going to serve us because we're going to be able to access those. So This slide is a nice metaphor that I like to talk about when we think about how much time we're spending on different things. So one of my coping strategies that I didn't list there, and something that I use for self-care, is gardening. I really love just being in the dirt and growing things. Um, I like tasks that have a start and an end. So something like weeding or pruning, I know I'm going to start it and I'm going to be able to finish it because it's finite. So if I was going to tend to like one side of my garden and not the other, then what's going to happen? That side that I'm watering, that I'm tending to, that's what's going to grow. That's what's going to flourish. The side that I'm not tending to, that's maybe going to grow some weeds. It's going to get overgrown. Maybe everything is going to die out. And so I think about emotional coping in a similar way. How much time am I spending on thinking about what? If I'm spending a lot of time focusing on all the things that are going wrong, I'm going to get really good at finding all the things that are going wrong. And that side of my garden is going to grow. And you might find me to be a really negative person, or I'm going to find me to be a negative person, and I might not want to be spending much time with me. It's a harder headspace to be in. So we're going to talk about what are some ways where we can spend time in some of these other parts, but keep in mind this metaphor of what we water grows. What you tend to is what's going to flourish, which is going to be particularly challenging because we are evolutionarily built with a negativity bias. So this means that when I approach something, I'm going to be able to pick out the thing that is not right, that's dangerous to me, but that makes sense evolutionarily. If I'm walking up to this lovely stream and I'm trying to catch a fish, I need to be able to see this guy, this predator towards me. So I know that I keep myself safe. So our brain needs to tell us, that's the poison mushroom. Don't eat that one. Be able to see that one and move past it. Well, our brain still does that. It's a little bit less adaptive these days because when we enter a situation, we're going to be able to see very quickly what's wrong. We've got this really nice, well-worn pathway, literally, of neurons that help us do this, which is less helpful when we're fighting to try to stay positive in the face of really challenging things. There's no shortage of things to be upset about. I just started my entire presentation off with all these reasons to experience negativity. But what we know is that that's not good for our bodies, our brain, and our emotional and mental health, which is why I want to address it head on today. So we're going to have a little practice with this negativity bias. So we take a look at this picture. We see a very overgrown yard, the lawnmower that's broken, this fence that could use some care and love. And those are the things that we're going to see. But what I also wanted to notice is that there's this really beautiful rose in here. It's maybe not the first thing that our mind goes to, but it's there. And it's this first step in trying to acknowledge beauty, gratitude, positivity, whatever it is we want to call it, is be able to look for that and train our brains to do better at seeing it. I'm going to start watering that part of our brain, essentially. And again, it's okay if you didn't notice the rose because, like I said, our brain's just built this way. It's doing what it's supposed to do in a context that just doesn't exist anymore for us. Our brain's not changing as quickly as our context. So one of the things that we can also work on is noting about when our body might be in fight or flight. When we become very stressed, we might become activated by something, and different people will feel this in different ways. A lot of people experience this as tightness in the chest, maybe heat in the body, or maybe feeling like a burning sensation, tingling sensation. That might mean we're in fight or flight. And if we're in that state, then we're going to look at this little kitten on the left, and our body is going to interpret it as the saber-toothed tiger on the right. Again, evolutionarily, this is what we were meant to contend with and get away from. What is less helpful these days is when we see something small and our brain goes, you know what, I'm going to make a giant deal out of this. And this is a saber-toothed tiger, and I want you to react in fight or flight to it. Not a healthy way for us to live. So I also want you to start thinking about, is this a kitten or is this a saber-toothed tiger when you start feeling yourself getting activated, whatever that feels like for you. So this is an excellent question. What are we going to do about all this? Again, I start this presentation with a little bit of negativity, again, to normalize the experience of what you might be feeling, but also want to offer some solutions. So one of the things that is most accessible to us in each moment is our breath. I say this with the full knowledge that people in this room likely have some lung involvement as a part of their illness. And so breathing isn't as easy as it used to be for you. Also, what we know is if we can regulate our breathing, we can regulate our thoughts, how fast they're going. We can regulate how fast our heart is pumping, and we can re-regulate our nervous system just with our breath. If it's difficult for you to take a deep breath, easiest thing to do is to do a strong exhale that will empty your lungs, and they will automatically fill back up to the extent that they can. You can find this animation really anywhere online. You can Google breathing pacer. And there's a lot of different ones. I like this one because it's a little bit hypnotic. It's very grounding. And if you pace your inhale to the expansion and your exhale to the contraction, so this being the inhale, and that being the exhale, that's going to help re-regulate your nervous system when it's activated. Lots of different things can activate us. It might be a phone call from somebody. It might be an upcoming doctor's visit. It might be some bad news. It might just be the neighborhood that keeps parking in front of your driveway. It could be anything. This breath that's always available to us is what's going to help regulate very quickly. That's one approach. Another approach is practicing gratitude. Again, I share this with the full acknowledgement that this is a difficult thing to do, and in no way am I saying that this is an easy thing to do, or that I'm saying just be grateful. Absolutely not what I'm saying. There is a great body of empirical research that's telling us approaching life with gratitude results in the reduction of problematic mental health symptoms. Practicing gratitude helps us overcome that natural bias towards negativity that I was speaking about. What the research tells us is that people practicing gratitude are happier, less depressed, less stressed, more satisfied in relationships. They have a higher sense of purpose, better coping skills, less trouble sleeping, and stronger circles of support. What's really bananas to me is that after 1 week of practicing gratitude, that was the initial study. And then, so practice gratitude 1 week. And then we went back to these folks 3 months later and 6 months later. That happiness extended into those months. So we see lasting impacts by learning to approach things with gratitude. Now, in speaking with scleroderma patients for the last decade, which I've been doing, I know that what you're grateful for changes. And you have to be able to change what that bar is. Some days the gratitude is, you know what, I stepped out of bed and my feet didn't hurt today. You know what, I reached out to open that door today. My hand cooperated. I got that door open. Some days it's, you know what, I was able to take a walk around the block. So the gratitude can be big. The gratitude also has to be in these little digestible pieces too. Because if we just wait for that huge thing that we can be grateful for and don't engage in these smaller things that we're doing every day that we're taking for granted, that's going to make it more difficult for us to practice gratitude. Another piece that I want to talk about today is practicing self-compassion. Again, might be a thing that sounds a little hippy dippy woo woo, but is backed up by empirical science. There's a large body of research to tell us that this is going to help us with mental health symptoms and physical symptoms as well. Self-compassion is made up of three different parts: mindfulness, which I'll talk about in more detail, self-kindness, and connectedness. So mindfulness will go into, this is essentially a rebranding of Eastern concepts into Western language that has now been studied in the West, and is being employed in a lot of different ways. Self-kindness means treating ourselves as we would treat one of our closest friends or loved ones. We are infinitely less kind to ourselves and more critical to ourselves than we would be to a friend. An exercise I like to ask people to do is to think of something that you've been struggling with and how you would talk to yourself when that's the case. So maybe you had a social interaction that didn't go well, you said something that you didn't mean, it went a little sideways. How do you walk away from that? What's the internal monologue? A lot of times it's like, oh my God, I can't even believe that I said that. I feel so stupid. What an idiot. What kind of person says something like that? Good grief. What were you even thinking? This is a really common internal monologue. Question now is, if your friend or loved one came to you and said, this is this thing that happened, I said a really dumb thing in front of these people, are you, as the best friend or partner, going to say, that's the stupidest thing I've ever heard? I can't believe you just said that. Are you an idiot? You must be an idiot. Why would you do that? We don't talk to our loved ones that way. We don't talk to our friends that way. We talk to ourselves that way. So a piece of self-compassion, a big piece of it, is learning to silence that inner critic and reframe how we're talking to ourselves. And the final piece of self-compassion is connectedness, remembering that we all make mistakes. We're all part of this human condition. None of us are immune from suffering because we are human. And so we can connect with each other in suffering, and connection can relieve suffering. Again, we want to make sure we're connecting with people that help us feel good and loved and safe, and not with people who help us feel in other ways. So I mentioned mindfulness, and I want to break that down a little bit. Mindfulness sounds very simple. It's actually very difficult. Mindfulness is paying attention on purpose, in the present moment, non-judgmentally. It's easy to say, difficult to do. So it means that we're present in this moment. I'm attending to what's happening. I'm not on like automatic pilot, right? I'm not, maybe you've done that thing where you've driven home and all of a sudden you're in your driveway and you're like, what? I'm not really sure how I got here, right? We weren't being mindful if that were the case. We just kind of automatically went into this thing. Same thing with emotions. We can just react if we're not paying attention to where we're at. And it is an active thing that we have to do. That's the on purpose part. And for some folks, the hardest part is the third piece, the non-judgmentally. How can I just be present in this moment purposefully and not judge it? I can just hear what's coming up for me and let it pass. I like to think of it, this is somebody else's metaphor, but I really like it. This idea of, if I'm a fish and I'm swimming and I see a little hook hanging down, I have the choice. Do I latch on to that hook and hold tight? Or do I notice the hook and I keep moving past it? So we all have those things that are our hooks, something that could just get us more quickly than anything. And so being mindful helps us see that hook and keep swimming right by it. So we're going to do a little mindfulness practice right now. Very simple. You don't have to do anything different than just pay attention in the moment, non-judgmentally. So I'm going to share my inner log as I'm looking at this picture of this flower. It's a really beautiful flower. It's very bright yellow in the middle. There's beautiful pink petals. Maybe it's rained, or maybe the sprinklers went off earlier today. It looks like maybe very lush and green behind it. All of that is me taking a moment to be present and look at this. Something very common that's going to happen because of the negativity bias is me to think about, oh, well, this is a really beautiful flower. It's out there, to help things pollinate and reproduce and keep our ecosystem. Oh my God, what about the bees? We're losing the bees. We have problems on our planet right now. And now we're in global catastrophe. So how do I go from mindfulness, right, to global catastrophe? It takes me less than a second, takes anybody less than a second, but we're not going to judge it. We're going to notice that we did it, and we're going to come back to the present on purpose. Just refocus ourselves. It doesn't matter that I just spun out about the bees, okay? What matters is that I noticed I was doing it and I came back. That's going to help us emotionally when we get really activated to be able to recenter ourselves and come back to this. So then why am I wanting to be mindful? All of these reasons. Practicing mindfulness, this is all empirical data from various research studies. It's been shown to reduce pain because it helps us be in the moment. It increases the ability to cope with chronic pain even. It decreases anxiety, depression, hostility, and the tendency to turn emotional pain into physical pain. So you remember that long list of symptoms I went through towards the beginning of this, the symptoms of scleroderma. Doing and practicing mindfulness helps with all of these things, helps us manage stress more effectively. We know when we feel less stressed, our body feels better, our minds feel better. It allows us to relax more quickly. We can experience energy increase, a self-esteem increase, helps us learn to cope more effectively with both short-term and long-term stressful situations. So this is, I think, one of the most magical things that we can do is to learn to practice mindfulness, being present in the moment, non-judgmentally, and on purpose. It has long-lasting impacts, just like gratitude does, and it shows up in all sorts of different areas of our lives. So it covers all those different domains that we talked about at the beginning that scleroderma also impacts. Please don't hear me saying that this is a cure for anything. I'm saying that this helps decrease symptoms that you may be experiencing as a result of illness or of caregiving or just being a human. And there's a lot of ways to access mindfulness. There's different meditations. There's a number of different apps, a lot of different ways to do this. You can do this while vacuuming, while doing the dishes. You don't have to be, at some, thousands of dollars resort sitting on a mountain with your legs crossed and meditating. That is a way. But again, we need these things in small, manageable chunks so that we can do them. They have to be more accessible than thinking, oh, well, I have to go away to this giant, silent 5-day silent retreat in order to experience this. These are things that we can do in our everyday, and we need to be doing in our everyday to help us feel better. The more we do it, the better our brain is going to get at it. It's the same thing as building a muscle. If I go into the gym and I work out my left arm and not my right, then guess what? I'm going to have a big left bicep. Nothing's going to go on my right side. Same thing happens in our brain. The more that we use stuff, the bigger it gets, the better it gets, the more efficient it gets. The more we practice it, the better we do. Okay, I want to come back to this piece of self-compassion. And I talked about that self-critical voice earlier and how we might talk to a friend. Again, this is backed by science. We see actual brain changes. We see physical changes as a result just of changing how we talk to ourselves. Self-criticism, I think, is how most of us were raised. It's a motivating force. It is effective. Think about the football coach that, stereotypically is yelling at their team to go and do, or the drill sergeant. Yes, that's motivating. What research tells us, however, is that's strongly correlated with depression and dissatisfaction with life. Okay, so it's motivating, but it doesn't help us feel better. Okay. Self-compassion is motivating and it helps us feel better. So with self-criticism, we begin to release stress hormones in our body, which impact how we're feeling, right? It can start triggering some of those those symptoms that I mentioned before, and contribute to that dysregulation that helps us feel really not great. When we speak to ourselves with self-compassion, what blows my mind every time is that it releases oxytocin. So this is a different hormone. And oxytocin levels, when they're higher, result in feelings of trust, safety, generosity, connectedness, compassion for ourselves and others. And we have some control over this. The more that we can practice speaking kindly to ourselves and being mindful, we can increase our oxytocin levels. Oxytocin reduces fear, anxiety. It can actually counteract increased blood pressure and the cortisol hormone that's released with stress. So this is easier said than done. It's hard to change how we've been thinking, especially if you've been talking to yourself unkindly for decades. You know, those muscles are very strong, and we have to really work to build these other ones up. So if this sounds appealing or familiar to you, feels familiar to you, yeah, this is a thing that I do. These are some ways to combat that self-talk. Ask yourself, what am I observing and feeling right now? Okay, I might be feeling increased heart rate. You know, my Fitbit or my Apple Watch might be agreeing with that. I see that my heartbeat's increasing. Okay, so what do I need right now? You know, it would really behoove me if I could just go into another room and have some quiet. So do I have a request of myself for someone else? Can I go into the other room and just have some quiet? Do I need to ask that of myself? Do I need to ask that of somebody that I live with? And can I do that? That's one way to help yourself combat the self-criticism. Again, takes a lot of mindfulness. You have to notice when you're being self-critical. We have to make an active effort to soften the voice that you use towards yourself. So when I'm speaking, you might notice that there's not a lot of variation in my tone. It's pretty soft. I try not to use a lot of big words. And that's, especially when I'm stressed, that's when we need to talk to ourselves. If our body's in crisis, then we aren't hearing and understanding things as well as we normally do. When our bodies are literally in crisis, we lose IQ points. It's much harder to be able to take information in and understand it. So being able to calm yourself and speak to yourself kindly, hugely important. And try to reframe the observations made by your inner critic in a kind way. So if you're beating yourself up for forgetting the dry cleaning on the way home when you were running 16 other errands, you can either call yourself an idiot because you did that, or you can reframe that and be like, you know what, I was really busy. Thank goodness I got to 15 other things done. You know, good for me for doing that. I'll get the dry cleaning tomorrow. So again, it might seem like really simple things, adjustments that you could do, or they might even sound like there's no way that's going to work. And the worst thing that can happen is that you try and it doesn't. But I would argue that it's worth giving it a shot. So also wanted to talk about building hope. This is connected to the gratitude I mentioned earlier. And these are not easy things to do, but we know that they help us in the long run. And these are some of the ways that we can build hope. You'll notice some familiar things here: practicing self-care, normalizing for yourself that sadness and nostalgia are really normal in this context. So maybe thinking back prior to diagnosis, that pain that comes with the nostalgia of that, sadness that comes with that. Being able to focus on possibilities, whatever that might look like, it's going to help you build hope. Remembering your strengths. There's no one in this room who was not a ridiculously strong person. To live with this illness, whether as a patient or a caregiver, y'all are the strongest people that I come across. Think about what your strengths are and think about how you can leverage those in the face of whatever the challenges are that are coming for you. And some of those, and we got to think about the ways that those are transferable, you know? So maybe you have a really great sense of humor. That's one of your strengths. How do you leverage that to engage when things are difficult? You know, how do you use that to build hope? The good news and the bad news is that emotions are temporary. That's great news when the emotions are really bad. It's a bummer when the emotions are really good, but we can remember that they are temporary. This is going to pass, but those overwhelming feelings, they'll go away. You'll get a break from them. And so knowing that, being present in the moments when you are having emotions actually helps them pass more quickly. I know we have this desire to like shove them out, shove them down, push them away, push them away. I don't want to feel anything that feels awful. But if we can let that wave hit us and we can kind of jump with the wave and ride it, we're going to do better. And those intense emotions are going to pass more quickly. So I've said a whole lot of things. I am very happy to, I'm going to unshare my screen so I can see folks. And then see if we have any questions that have come up in the chat.
Well, we really appreciate you being here and taking time out of your Saturday to join us. I think it's a
Course.
topic that's so important and something that people have been asking for quite a while. So we really, really appreciate it.